Good afternoon, folks. Today's a discussion. We're talking about long-term care reform. Okay, um, folks, long-term care reform cannot wait because folks like elderly people in nursing homes need better conditions. Some places they need better reforms for better conditions. Okay, so I'm going to go through the presentation I made for you this morning or this afternoon. So hope this gives somebody some insight as to nursing home care reforms. All right, so here we go. Long-term care reform cannot wait. The case for urgent long-term care reform is brutally simple. Demand is exploding. Financing is broken. And workforce and families are holding it together. Workforce and families holding it together are already at the breaking point. Delay is not uh, neutral. It is a it is it is a decision to let more people fall through the cracks. The longer we wait, the more expensive, chaotic, and morally indefensible the system becomes. The demographic clock has already started. The United States is aging in place. Our policies have not even begun to match. Aging population by around 2030, more than one in 5 Americans will be 65 or older. The 85 population, the group most likely to need intensive long-term services and supports TLTSS, is the fastest growing demographic in the country. High lifetime need. Roughly 70% of people over 65 will need some form of long-term services. Not might, will. Family size is shrinking. Fewer adult children are able to provide care. And more older adults live live alone than at any point in the US history. Chronic illness and dementia are rising. Alzheimer's alone is projected to nearly double by 2050, reshaping the demand for 24/7 care. This is not a niche issue. Long-term care is the rule, not the exception. And the system we have today was never designed for the population we have now. The financing system is structurally unjust. The current financing structure is a patchwork that leaves families exposed and states overwhelmed. Medicare doesn't solve this. Medicare covers only limited post acute and short term skilled care. It does not provide comprehensive long term care coverage. Private insurance has failed. Long term care insurance is expensive, confusing, and increasingly unavailable. Only a small fraction of older adults hold policies, and many insurers have exited the market entirely. Medicaid as default payer. Medicaid has become the primary payer for LTSS, but only after people spend down their assets to poverty. Home and community based services, HCBS, remain optional, benefits leading to years years long waiting lists and geographic inequities. The middle class is unprotected, too rich for Medicaid, too poor for private coverage, and one crisis away from financial ruin. The result is a cruel triage. The poorest rely on Medicaid, the wealthiest pay out of pocket, and everyone in the middle is left to tend to fend for themselves. The workforce and family caregivers are in crisis. The people providing care, paid and unpaid, are stretched to the breaking point. Workforce shortages, direct care workers, nurses, geriatricians, and home health aides are uh, in chronic short supply. Low wages, high injury rates, and limited career paths drive turnover. Unpaid caregivers as the invisible backbone. Over 50 million over 50 million Americans provide unpaid care, delivering hundreds of billions of dollars in value. Each year, they sacrifice sleep, income, health, and stability. Burnout is widespread. Caregivers report depression, anxiety, and physical strain at rates far above the general population. System at system at a tipping point. States themselves describe critical emergencies in caregiver availability. Hospitals and nursing homes are absorbing the fallout. We are not waiting for a crisis, we are living in one. Every year of inaction pushes more care from trained workers into or onto exhausted families. The cost of inaction is higher than the cost of reform. Failing to act is not fiscally conservative. It is fiscally reckless. Financial risk to families. Average lifetime paid LTSS costs for a 65-year-old exceed 100,000, with a substantial minority facing more than 250,000. Pressure on Medicaid and state budgets as middle income adults exhaust savings and fall into Medicaid states facing rising LTSS expenditures without a without sustainable financing plan. Economic drag, caregiver burnout leads to lost wages, reduced labor force participation, and employer productivity losses. Hospitals and nursing home strain without adequate home-based and inequitable way possible. What urgent reform must do? Urgent long-term care reform should be framed not as a single bill, but as a national care infrastructure project with at least 4 pillars. Create a stable LTSS financing mechanism. Social insurance, middle class from catastrophic costs. 2. Make home and community-based services a real guarantee benefit. HCBS should not be optional or capped. They should be accessible and equitable and designed to support aging in place with dignity. Invest in the care workforce as essential infrastructure. Raise wages, improve training, and create career ladders for direct care workers and geriatric clinicians. Treat this workforce like the backbone of the system, not a disposable resource. Recognize and support family caregivers as co-workers in the system. Expand paid family leave, respite, caregiver training, and tax credits or stipends. Build policy that assumes caregivers are partners, not free labor. The moral and political bottom line: long term care reform is not an aging issue, it's a family issue, a workforce issue, a gender equity issue, and a disability rights issue, and fiscal stability issue. Every legislator who talks about supporting families, protecting the middle class, or strengthening the economy is already talking about long term care, whether they acknowledge it or not. The question is no longer whether we will pay for long term care. We already are, through drained savings, unpaid labor, and stressed state budgets. The real question is whether we will keep paying for it in the most chaotic, unadjusted way. Possible. Or finally, build a coherent system that matches the reality of how Americans live, age, and care for one another. Okay, guys, that is your A. I will be back on in a few seconds for B. For now, Cater Wellness. Take care.